All right. Tell me and I will
Yeah,
continue.
we're ready for you. Go ahead.
Okay. All right. So this presentation is entitled Back Pain Causes and Remedies. Okay. So acute back pain, particularly lower back pain, is very common and it will often go within a few weeks. And some people live with more ongoing back pain that doesn't have a serious cause, and there may not be a, actual diagnosis made for that, or a cause found, or that's easily identifiable. Okay, so different people's descriptions of their back pain is often different. So it would include things like muscle aching or shooting pain or a stabbing sensation. The pain may radiate, it may go down a leg, and if we think about it, so certain movements will often may make the pain worse. So bending, twisting, lifting, standing or walking, which is a lot of what we do in our lives, can make the pain worse. Okay. Okay, so there are many possible causes for back pain, and as has been said, the cause may not be clear. However, the commonest causes are a muscle sprain or strain. So if you sprain your muscle, that's the commonest cause of back pain. Musculoskeletal, muscle strain. Other causes can be due to wear and tear. So arthritis, that's pretty common. And then the other reasonably common causes are things like a slip disc in the back, if that's and that can press on a nerve. Um, and then there are some inflammatory conditions, like one called ankylosing spondylitis, which is not rare but not hugely common. But it's sorry, but those are the common. Let's go back to that one. Okay. Um, okay. And rarely back pain can be a sign of a serious problem, such as a broken bone, cancer, or an infection. But that's relatively rare. Back pain, in terms of associations, back pain is more common with age. So as we get older, we have more back pain, but that is not to say at all that young people do not have a whole lot of back pain. That's increased a lot in the last generation, with particularly lifestyle related, in terms of the way that people sit and use particularly devices such as iPads, computers, etc. And it's the posture that then um, that contributes to back pain. So back pain, I'd say, is also common in younger people. And then so lack of exercise can worsen back pain because the back is best supported by muscles that are exercised and used in the correct way. So that's so muscles in our back and abdomen support the back, and if they're not exercised, then that may lead to back pain. And we're going to go on to it. We'll go more onto it later, but any exercise should really be, especially as we get older, should be like tailored and appropriate for us. And it's not one size fits all. If excess weight, so if somebody's overweight, then there's more weight going through the back, and that can make back pain worse. And of course, um, improper lifting, so not lifting in the way that you're meant to lift, and that can sprain the back and make things worse. Okay, so okay, I wanted to reiterate, even this early on in the presentation, common things are common. So people think that when they have a back pain, or some people think that when they have a back pain, it's the worst, but by far the commonest cause of back pain is a muscle sprain or muscle pull. And particularly if you can relate it to something that you did, and that's when the pain came on, that may then be the whole answer. And then as we get older, arthritis, wear and tear, that's also a common cause of back pain. Okay. All right. And at the same time, so like quite a few things in life, medicine is paradoxical. So common things are common, but at the same time, you need to hold out two possibilities and have our radar out for when to seek medical help. And essentially, those are when the symptoms are out of the parameters or out of the limits that we mentioned. So if you have a back pain that comes on that doesn't go away in a few weeks, if you have a new back pain, for example, or you have a new back pain that is severe, like it is really severe and it's not getting any better, and including when you have a back pain that is that's severe at night and one that wakes you up from sleep, that's something to worry, potentially to worry about. If you have a back pain that spreads down one or both legs, particularly below the knees, that can mean that the nerve is pressed on, so that would be a concern. You should seek some more input, health practitioner input for that. And especially if you're having a weakness, numbness, or tingling in one or both of the legs, you should go for further input for that. And then if there's unexplained weight loss, definitely would want to have that looked into. So these are all just out of that norm of the back pain coming for a few weeks and then getting better. There are some scenarios which are rare when you may want to seek immediate medical help, as in go to the emergency room. So if somebody has back pain associated with new bowel or bladder problems, particularly new incontinence, but any new bowel or bladder problems, that's a time to seek medical help. If you've got an accompanying obvious fever above 38 degrees centigrade and back pain, that's something potentially to be worried about. And then really not to rationalize it or make it all okay if you've had like a fall or a blow or have had a road traffic accident, or you've fallen from a height, or you've fallen off a bicycle or off a motorbike, that kind of thing. There may often be some serious damage there. So we have a friend who fell off his motorbike and was walking all day thinking his back was not too bad. He's with his cousin, and then at the end of the day still had back pain, but thought it wasn't too bad. But anyway, went to the emergency room and had 3 big fractures. And so that's an example of the cause of the back pain, and then just being more cautious about that. In addition to these things, I would just think generally in your body. So I think if you have back pain but associated with, say, stomach symptoms, so stuff like lots of diarrhea or vomiting, stuff like that, and back pain, especially if it's been going on for quite a while, that I think I'd be careful about. If you had back pain associated with shortness of breath, that's not really right. I'd be cautious about that. If you have back pain associated with headaches that are not normal for you, I think that would be something to be concerned about. Just thinking kind of laterally now. And also for women, if you had any gynae symptoms associated with back pain, I think that would be, that in itself should be checked out separately. And with all of that, these types of more serious back pains are rare. However, they're still possible. Okay, so I wanted to say something about X-rays and scans. So whilst they can give some indications of changes, they're most useful in excluding serious pathology, serious things going on. For example, fracture tumor, a fracture, a cancer tumor, or severe osteoporosis. So the thing in scans is that they often the changes do not correlate with people's symptoms. And lots of people say over the age of 60 have got little changes in their scans. And the thing is that, yeah, there are people with quite a lot of symptoms who have very little changes on their scans. And there are people who have quite a lot of changes on their scans who have very little symptoms. So you do not want to, most of the time, you don't want to just treat the scan. So it's important to think holistically about the patient. So you really need to take a good history from the patient, see what the symptoms are, and then have the scans or the radiography as an adjunct to all of that, and not just go solely on the scans. That's quite an important thing. Okay, so right. I'm going to reiterate, we've mentioned it in previous topics that we've done in previous presentations and discussions. So maintenance, prevention is really important across the board in whatever situation, pretty much, we're talking about in medicine. But with our bats, it is important always, especially as we get older. And in the back, it's got certain mechanisms that are important to attend to. So we want to maintain freedom of movement and range and coordination of the joints to optimize functions. That's one aspect of the back. We also want to have strength and stability to protect the back from injury. So it's both that freedom of movement, flexibility, or freedom of movement, and that strength and stability. And if you think about these, they're usually strength, stability, and then freedom of movement. They're usually contradictory qualities. So in things in nature that are stable are not necessarily flexible and mobile, and vice versa. However, some things have both. For example, a willow tree has both. Just want to say that, but some things don't in nature. However, as we said, these two aspects coexist in the spine, and therefore exercises should be addressed to both of these aims. So both the flexibility and the stability. For example, yoga-based exercises often promote flexibility, although certain postures in yoga require some core stability. Pilates, for example, is primarily associated with core stability, but will also address some flexibility. Okay, go onwards. And you don't necessarily need to do yoga or Pilates. There are some daily simple exercises that can be practiced at home. And so this is the second time I'm mentioning it. I think it's really important that it's not one size fits all. And I would say that we need a detailed assessment of each individual and appropriate prescription of tailored exercise. The problem is if you give a universal exercise or similar exercise regime to some people, it's going to cause them pain and damage because that's not the appropriate exercises for them. And they've got limitation in an area where you shouldn't be moving. So it needs to be individually assessed. But exercise is important. And then there are various treatments that can be used once you have a serious cause of your back pain excluded. So those would be medications, so anti-inflammatory medications, if you can take them, painkillers, sometimes nerve modulation agents. So those are certain tablets that can modulate the nerves, exercises, and rarely more interventional approaches such as surgery. Okay, so just a little bit on back pain injections. So where there's been a back pain that's been significant for an ongoing period and hasn't responded to other levels of management, then injection therapy, there may be a place for injection therapy. So in two broad categories, it can either be what's called a facet joint block injection. So the facets are where the nerve roots come out of the spine. So they're at the side of the the vertebra. So those are the bones in our spine, the big bones in our spine. At the sides, they have what's called facets, and then the nerves come out. And you can block that with an injection, anti-inflammatory injection, and that reduces inflammation around the nerve and can help the pain. Or you can do something called people do what's called something called an epidural, where you actually go to the main part of the spinal cord. It reduces inflammation around that, and then you can reduce. This affects the nerves at various levels that come out below that. So it then reduces the pain from those nerves that come from that part of the spine. So that's just very, yeah, that's a basic thing about injections. So thought to mention something about dry needling and acupuncture. So physios or chiropractors, for example, may offer this. There's some emerging evidence for acupuncture and dry needling. So acupuncture is based on a traditional Chinese medicine paradigm, but has been better understood in Western terms. Dry needling uses acupuncture needles, and its scientific mechanism works on the autonomic nervous system. So we've mentioned that in previous talks, I think related to sleep and exercise, but the autonomic nervous system is the non-stressful part of the nervous system. So when it's the parasympathetic, right? The autonomic nervous system consists of the sympathetic and the parasympathetic parts of the nervous system. Dry needling affects the parasympathetic, which is the non-stressful parts, the rest and digest, and it creates more relaxation. The blood vessels dilate, and then there's locally improved blood flow, and this helps wash out some of the pain metabolites. So that's thought to be a mechanism whereby dry needling can help. And thought to mention a little bit about chiropractors and physiotherapists. So chiropractors work from a central spinal approach using adjustments, manipulations, which are highly specific, high velocity thrusts. Physios tend to do mobilizing techniques, which are more rhythmical and can sometimes be generalized. Both do soft tissue release, including trigger point therapy. And I think if you're ever deciding, should I see a physio, should I see a chiropractor, I'd have a good chat with one or the other of them and see. I think it could be quite a nuanced thing about what one can treat, what another can treat. I think that's kind of my suggestion on that. Okay, wanted to mention, couldn't really cover this subject without covering a central part, which is slouching on the couch, which is part of our lifestyle over the last generation, really, or at least half a generation to a generation. So what happens? Slouching on the couch is not good for your back. So people often slouch on the couch and then will read a device like an iPad or a laptop, and the spine should have an S shape. I'm going to show in following pictures. That's when we are best, when the ligaments and the tendons and the vertebra are in best alignment, and we have best flexibility and strength in our back. But when we go to slouching on the couch, we go into a C shape, and our ligaments that surround the spine are not actually intended for that, and so we don't get best movement of our back. And so one way that you could look at it, so if you have a finger and it's generated, it's designed to bend like that. However, if I try to bend it backwards, some people can, I mean, a few people can, I cannot do that. I've tried to do it. That's not how it's designed. The ligaments are not designed for me to do that. And in a way, when we do C-shaped back, we're trying to make our back work in a way that it's not designed to do. And so slouching on the couch is not good generally. I'm going to show a couple of pictures. Right, this is the S-shaped curve of the back. I don't know, just when I look at it, I breathe easier than when I look at the C-shaped curve. That's a C-shaped curve. So you can just get an idea that in this, I think this one I made that there's a tumor or something else going on. It doesn't matter, but there's a C-shaped curve here, and you can just get a feel there's less flexibility, less buoyancy, less flexibility in that back. It's more kind of stuck. And okay, so yeah, as I was saying, lots of ligaments and muscles in our back, and when we're on the slouch doing our when we're on the couch doing our slouching, we forget because we're engaged in the screens in front of us. Important to pay attention to 2 points: the position you're sitting in. So ideally, you want your knees higher than your bum and your bottom. Than your hips. Knees higher than your hips. And how long you sit. So there's emerging evidence, pretty much evidence that you should sit for 45 minutes to an hour and then move around. So even if you move around for a minute or two and then go back to sitting, that is a good thing to do. That will help. So that's it. That's what I have in terms of the presentation. So I'm going to stop the sharing, and then I'm open to your thoughts, questions.
Here, questions.
Is it all straight? Does it all make sense?
Yeah, let's get the doctor's feedback.
Doctor, can I ask you a question? What's on the right side above my hip is like a round bone sticking up. And that causes me pain going down my thigh, down into my leg. Is that a slip disc or something that worries me? I can feel it behind me, like where my belt goes.
Okay, so if you would, I can kind of hear the question. Would you mind repeating the question, Rabbi? I kind of 3/4 got it.
Go ahead one more time.
But the middle of my back or my waist, the right hand side. Like
Yeah.
Sticking up. I can feel it with my hand. It's always sticking up. I don't know if it's a slip disc. And the exercise we do on a Tuesday, Dr. Henry said it should come back into place again, but it hasn't. And what is it?
Did you say that did you have some treatment for it?
No. Well, I've been doing exercises on a Tuesday, and we thought maybe it would go back into position again. But it's still
Yeah. I mean, it sounds if it may be a disc or it may be muscular. I think probably it would be sensible just have it checked out to see if it's either of those. You may need an assessment of it.
But do I need to go to a chiropractor?
I think I would think probably somebody like a physio would be like a standard. So they do the soft tissue manipulations. The chiropractors go more to the center of the back. But I think if you started off with somebody like a physio, that would be like a reasonable first thing to do. And then if they thought that chiropractor would be appropriate, they would say that. But I would have thought physio would be reasonable for that, to be honest.
Something on it? He was. Physio probably not.
I think it's different in Australia and England and here.
Yeah.
Dr. Stern, I've just had a long period of acne, which has been corrected by the chiropractor, and the needles and the jerks, and everything is fine now. But I do find that I have to take a cushion with me to keep my back erect wherever I sit. Is that
Okay, that's interesting. So and you feel better with that?
sorry?
Do you feel better with that?
Yes, thank you. I do feel much better.
and it feels like a comfortable position for you to be sitting in, and you can manage that. That's great. So then that's appropriate. You know, you've been appropriate management for your individual situation. That's good, isn't it? You've realized what, you know, what supports your back.
Thank you.
Yeah.
Okay, any other questions for the doctor?
Is it all straightforward?
He straightened everyone's backs.
Is it was it? Yeah.
Reality.
I think we also have to be aware of how we bend.
Yeah.
Aware that you bend from your knees, not your back.
Really?
Yes.
Yes. Yes, yes, yes.
A crouch bend.
Yeah.
That's new
Yeah,
to me.
yeah.
Picking up, you must pick up with your thigh muscles, not
Yeah.
your back.
Yeah. Yeah, yeah. Or else you put strain on your back that way. So that's important. Was any of this information new to you?
That is very helpful. Thank you.
He's asking if it's new.
No, it's not new.
Not new. You knew it all.
Well,
But it was a reminder, a refresher.
A refresher.
I've just been through it, so
Yeah.
it was wonderful. Thank you.
We're all sitting here because we have a problem which we've been told about. So it's good to hear from you as well. It reinforces the message.
Is it really? Okay, that's good. And was that so? Somebody was interested in having the session on back pain. Who was it who suggested back pain?
You asked it, right?
Sorry.
You the
You
one who
asked.
requested for back pain.
Yes, I did. And subsequently I have been cured.
Well, that's very good. So I think this is helpful if it reinforces what you knew, it's good. So reinforcement of knowledge is good.
We didn't decide because the physio did not help. And
Okay.
to a chiropractor, we did help. So
That's
which-
yeah. I don't think it's for me to say. I don't think it's so straightforward about knowing the differences. So I think so as I understand it, physios tend to do more rhythmical manipulations of joints, more of the peripheral joints. I'm not an expert on that because I'm not trained in physio or chiropractor. So more of the peripheral joints, so soft tissues, any of the joints in your body, they'll mobilize it. Whereas chiropractors tend to be trained around doing the back, and they do more short treatments. But as to how that correlates with particular symptoms that you have, I think it's quite nuanced and quite detailed. And I think you would want to have a good old conversation with one of those two practitioners who you trusted, you know, and then you relate your symptoms, and then I would think it's about your journey with the treatment that you've had, what you've tried, and then you kind of see if it fits into to you know that more of a physio chiropractor. But physios don't tend to do those manipulations on the back in the same way that the chiropractors do. But that's great. I mean, you've explored in terms of your back, and then you've found what worked for you.
Well, I'm going to take this opportunity to thank you, Dr. Stern, once again for your beautiful, interesting, fascinating, and informative lectures. And
Okay, great.
we'll see you in person, please God, in January.
Yeah. So it will be I think it'll be the end of January. So I'll be in touch with you.
Is there a particular topic you want to ask Dr. Stern, or do you have a particular area of expertise?
So if you want, when do you come back after the holidays?
Come on the 15th of January, please God.
On 15th. So if you would like, I can do one before I come face to face. I could do another Zoom one if you
would have to be the week after. I personally won't be on the 15th. Just
so like that.
He's gonna do. So I'll probably be back the next week, the 22nd.
22nd. So I'd be happy to do that. Is there a topic? So is there a topic somebody would particularly want? And you
surprise us. It's all not everything's wrong. We just want to learn about everything.
or else no, not nothing's wrong. It's all up for and it's interesting for me to look at it also. If there isn't, then I'll choose one. I mean, it's the last one I chose was
It's fun, and let
allergies.
me know. I'll put out a flyer for it and let us
Okay.
know. Awesome. Thank you so much.
All
I
right,
wish-
cool.
Later, Dr.
Age related. Yeah. You don't want pediatrics?
So,
You don't want another pediatric one. What kind of age related?
No birthing either. Okay.
What kind of age related thing? Because there are lots of age related things.
The most common.
Well,
Do you want me to do? Is it going to be interesting? I could do one on polypharmacy. So as people get older, they tend to go on more medications, and so generally, as people get older, we want to keep the medications that are necessary, and then have a look at which ones are very necessary. So the categories of ones that are very necessary, categories of ones that are intermediate, categories of ones that are for discussion. Would you like me to present
good.
that?
You're
Is
getting
that
a lot of affirmative? Yeah, everyone's liking that idea. Maybe perhaps if you could throw in there, if there's ways of reversing one's conditions or minimizing medication or lowering the dosages of medications, if that's possible, what one can do to get there. What's that?
yeah, okay, so that's
Okay, that would be marvelous is the feedback we're getting, and we're looking forward
we
to
may
that.
need to do so that may be in one session, that may be like 2 or 3 sessions because it's quite a
Okay.
big
That
we'll
sounds
see. Yeah,
good. Looking
yeah.
forward. Thank you
All
so
right.
much.
All right,
Wishing you pleasant holidays, and we look forward
thank
to
you very
seeing
much. You guys also.
Thank you.